Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel. Today I wanted to talk about the CAC score, or the coronary artery calcium scan. If you have listened to my video about cholesterol controversy, you have noticed that I have some reservations about using statin therapy for some patients. Some of my patients are concerned about using statins when we discuss the side effects, which some of those include decreased energy level, decreased memory, increased risk for diabetes or metabolic syndrome, liver function abnormalities, muscle pain, erectile dysfunction, etc. Both my patients and I would like to know how we can risk stratify them for cardiac events. If you are an intermediate risk patient for heart disease, meaning you have a 7.5 to 20% 10-year risk of an event based on calculations with a calculator tool, then a coronary artery CT scan might be appropriate for you. The scan itself is actually not very expensive. You do have radiation exposure. The radiation exposure you get from a coronary artery CT scan is about 1.7 millisieverts, and this is about equivalent to what you would get from a CT scan of your brain, or something on the order of 10 times what you might get from a single chest x-ray. Not excessive, but also not completely trivial. When you have the scan, the radiologist looks at the scan and generates a calcium score and attaches a number to that score based on the results. This number can then be used to risk stratify you as an absolute, but then also as a number that can be followed with serial coronary artery CT scans to determine risk of progression. I reviewed a study that had about 40,000 participants that were evaluated with coronary artery CT scan. To me, it appeared that progression of your CAC score seemed to be the most important variable, not necessarily where patients started with their CAC score. If you had less than 15% progression in your coronary artery CT scan score, then your risk of an MI, for example, was 3% per year, regardless of your starting CAC score. On the other hand, if you had a starting CAC score low, less than 100 for example, but you experience greater than 15% per year progression of your CAC score, your risk was not 3%, it was 20% of an event. As you crept up in the CAC score, greater than 100, now your cardiac event for 6 years ramped up to about 50% when you had progression of greater than 15% per year in your CAC score. While this tool is not perfect, as none are, it can be used as additional information when you're trying to decide about your cardiovascular risk, and also if you're trying to decide about statin therapy. If you think statin therapy is beneficial to decrease cardiac risk, then this tool might help you to make a decision. The authors of the study suggest that if you have moderate risk factors and have a normal CAC score, you should probably repeat a CAC scan in 5 years. The authors also say if you have more significant risk factors with a normal CAC scan, you should probably repeat this in 3 years. I honestly don't see a great utility in using the CAC score for patients that have very high risk for cardiac events. I think the tool loses its value in these cases. Of course, patients are going to want to know what it takes to decrease progression of your CAC score. It's actually very simple. Avoiding toxic lifestyles such as poor sleep, decreased exercise, and poor diet. These lifestyle issues are common conversation in my office visits with patients. These things are reliant on patients to make changes in their life and are actually probably the most important things they can do, probably much more important than pharmacotherapy. I hope this information about the CAC score is helpful. If you are my patient, you can use this as supplemental information to our office visits. If you are not my patient, you need to see your own doctor to discuss your medical care. This is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Signing off.